So good evening, friends. Dr. Rajamendran, surgical gastroenterologist here. So we are happy to announce a new program from DocTutorials, that is a residency program. This is not only for MS general surgery, but also for DNB surgery. Definitely, this program is going to be a massive hit because the team we have is such a way. We have a list of faculties from various specialty, from various places. We're going to cover the entire surgical curriculum needed for MS exam as well as for DNB exam, including theory and clinical. So let me introduce the faculties here. You can see the list of faculties. Dr. Gopal Naik is going to cover general part of Sabiston, Swartz, and Bailey and Lau. Dr. Vikashini will be covering trauma part from ATLS latest 10th edition. And Dr. Arun will be covering gastrointestinal tract. And myself will be covering hepatobiliary pancreas part. And we have two oncosurgeons for covering a lot of oncosurgery topics in surgery, you know well. So Dr. Sendil Kumar and Dr. Dorian are going to cover the oncosurgery part of the syllabus. And we have endocrine surgeon, Dr. Mithun, for covering endocrine parts of thyroid, parathyroid, adrenal, etc. And Dr. Dinesh Balaji is going to cover the pediatric surgery aspects for your exams. And Dr. Vijay is going to cover plastic surgery contents for this exam. And Dr. Premnath will be covering neurosurgery, and Dr. Isaki Rajan will be covering cardiothoracic and some parts of vascular. Dr. Sendil Nathan will be covering complete vascular surgery, and Dr. Datatria will be covering urology, and Dr. Nandini Madam has come for operative surgery. We are going to introduce some more faculties for operative surgery also. As of now, the team formed is a complete faculty team has formed for the entire syllabus. And most of you would have seen, we have completed the recordings of the theory lectures, essay questions, and university questions of various universities we have already completed, and it is available in the lab, in your app. Like complete syllabus videos are already available. So clinical cases with the real patient, we are going to do it as a live session. Patient history taking is also going to be a live session. Signs, symptoms, and treatments are also going to be live session. And theory and important questions will be either recording or will be done as a live session. And latest techniques, procedures, everything we are going to show as a live program. And we are going to guide you in a closed WhatsApp group until your university exams. And we are going to show you a lot of intraoperative surgeries with step-by-step demonstration by the list of faculties. See, most of your institutes, you know very well, the exposure of many super specialties is not available. In such a situation, we will be giving you a detailed explanation of the various videos. For example, I will be showing D2 gastrectomy, and oncosurgery faculties will be showing thyroidectomy, mastectomy, and all the head and neck surgeries they'll be showing you. And we have various faculties to show various operative procedures. The basic operative procedures also will be shown by many faculties. And there are many live sessions, especially the operative procedures. We have planning for a live session. Sometimes you might feel to have, if you are feeling it will be better if you have a recorded session, we will do the recorded session. It all depends, because once the team is formed with the closed WhatsApp group, we will discuss whatever needed and we will plan accordingly. And case discussions will be done live only. So all the cases we are going to discuss. Every month we have 5 clinical case discussion, live interactive discussions on high yield. So live doubt clearing sessions by the top faculties will be there. Okay. You can see the March month schedule we have already made. Dr. Dorian is going to cover locally advanced cancer breast clinical examination, and I am going to cover gastric outlet obstruction clinical approach. And Dr. Mithun is going to cover solitary nodule thyroid. Intercostal tube procedures. And Dr. Nandini Madam is going to show you some operative procedure suitable for MS graduates this month. So we have made the complete March month schedule. Like this, we'll be releasing the schedule for every month. It will be 2 hours session every week. So we have planned it either as Saturday or Sunday session, so that you will be able to attend these sessions in the Sunday or Saturday. After 7:30, 8 only, you'll be having all these programs. So this session is going to be very beneficial for all the exam going MS postgraduates as well as the postgraduates who are joining in the first year. You can go for a 3-year residency program. We'll be covering you for the complete 3 years. So this is there are so many apps available for a residency program, but DocTutorials, you know very well, is a #1 for NEET SS program. And the NEET SS program, when you ask any of your seniors, they all would have utilized our app only. And this residency program is going to be the same way. I'm going to lead this program with so many schedules according to your need. So first of all, we'll be forming a WhatsApp group with all the students. And based on the WhatsApp group, whatever you are requesting, we'll be able to do with our team of faculties, because we are a big team formed now. Around 14 faculties are available in our team. So with this team of faculties, we are going to do extraordinary job for this residency program. Okay. So let me now, let me clear any doubts if you have. We are watching in the live on YouTube. Any doubts, if you have, you can post there, or we will be asking the faculties to share some inputs about their plan in the program. Yes, let us first welcome Dr. Gopal. Sir is going to cover general aspects of the surgery. You know very well the difficult part is general aspects. So general aspects like various sutures, shock, all those chapters are more general aspects. So I welcome Dr. Gopal. So Dr. Gopal, welcome please.
Welcome. Thank you, sir. Good evening, sir.
Good evening. Good evening. So, Dr. Gopal, first question for you. What do you feel the advantages of app-based learning for the students? Because initially I thought the app-based learning will not be good for the students. They have to go for exposure. What do you feel about this app-based learning programs for the residents?
Sir, as we know, there are
Please introduce about yourself. Dr. Gopal, please introduce
yes,
about
sir.
it. Yes.
Sir, I am Dr. Gopal Naik, Assistant Professor at the Government Medical College, Baramati from Maharashtra. Sir, I will be covering the general surgery part in the DocTutorial residency program. So, as we know, sir, there is a very little time during the residency. We have the residence has to do OPD, ward work, procedures, and as well as we have to go for some PG activity or some webinar during the residency. So there is a very little time to study or take a book and to read all the topics before the presentation or before going for any procedures or during the residency. During the first years, the boss will give the residents or JR1 to make a presentation of some topics or make a discussion on some important topic to teach the undergraduate student, and there is no time to learn or to read everything from the book like Sabiston or Bailey. The app will provide a very unique and a particular specific information related to the topic. Like if JR1 has to do it's his or her first operative procedure like hydrocele, he can watch our app video, operative video on the app and can do a procedures, and the exam or the his boss will ask about the before going to incision, tell me the operative steps of the procedure. The resident can do confidently or tell the confidently the operative steps after watching our videos from the app, and the app will provide the like ready to material to provide information, like he can watch the videos in OPD, in wards, during the his presentation or before his PG activity, so that the information he has to gain from a book or the information he has to take lots of time from the book, it will be reduced, and from the short time he will or she will get a lot of information about the topic, and that's why this app will be a reverse. It will make a life easier to the resident.
Yes, Dr. Gopal, you have already recorded some lectures for the students. Can you tell me about those lectures, whatever you have recorded for general surgery part?
Yes, sir. Sir, I have recorded the very basic topics like metabolic response to trauma or injury, nutritions, what are the daycare procedures, shock. These topic will be the basics, or every resident has to enter with the knowledge of this basic topic before starting his residency. On the day one of his residency, he will be in the OPD or he will be in the casualty, seeing the lots of patients with the shock, trauma, and lots of patients with the putting the central catheter, central vein, and he has to maintain the nutrition of that patient, and he will be confident after seeing all the videos from the app to do the ward works and the basic procedures.
So great. Thank you, Dr. Gopal. Thank you so much for the inputs about the general surgery part. And next, welcome
Thank
Dr.
you.
Senthil Kumar, our oncosurgeon. Sir is going to cover completely the most of the clinical cases. So let us discuss a few queries from your side. So Dr. Senthil Kumar, you are and please unmute yourself.
Good evening, Rajamendran.
Please, your camera is not clear. Yes. Thank you. Yeah.
Good evening. This is Dr. A.C. Senthil Kumar. I'm a consultant surgical oncologist. Right now, I'm practicing in Chennai. Now, I have finished my surgical oncology training at Adyar Cancer Institute in 2012. So, 13 years into surgical oncology. Have a long teaching relationship with Rajamendran. From the time we were in the previous institute and once RRM and DocTutorials were found, we joined the team and have been involved in teaching for the NEET super specialty program as well. Now, gone are the days we had our surgical time periods. So previously, when we were students in MS, long time back, so tomorrow a gastrectomy is posted. The way we used to prepare for a case and go is completely different from what we have now. So if tomorrow a D2 gastrectomy is posted, you are going to be the first or second assistant. You are expected to go to the library, brush up your anatomy, look at the other operative pictures from Ferguson, look at the possible steps, operative surgery. You never had YouTube videos on that time. You never had teaching points. But if you can get all of this, what you used to collect from the information, looking at big books, what takes about 4 or 5 hours, if you can get a condensed information of all this in a short 15 minutes procedure, that short videos like this can tell us nothing better, right? So technology, yes, it is available. We have to use it to the optimum. Definitely it will help. I feel that this is a good step, and hopefully we get to do a lot more together on this.
Dr. Senthil, what are the operative procedures you're planning to show from the oncosurgery topics for the students?
The concentration will be on the topics that will be of interest to the students. That is the common surgeries, oncology. You have to accept that oncology and gastroenterology forms about 80% of operative surgery as well in general surgery. 20% will be the remaining topics. I'm not including trauma. Trauma is a different field altogether. So most of it, like head and neck cancers, such as the oral cancers, the neck dissection, these are common surgeries that people need to know. A hemiglossectomy, a submandibular gland, or a parotid resection, a modified radical mastectomy. These are all common surgery. They should also know something like what is breast conservation, sentinel node biopsy, a partial penectomy. So the list is endless. Every organ you will have cancers, and most of the common surgeries have to be covered. I'm not going to talk about very unusual topics. Something like a commando may not be relevant for a very common procedure, may not be the commonest procedure, but they need to know the principles. But a neck dissection, yes, the postgraduates have to.
Thank you so much, Dr. Senthil. Thank you so much for your inputs. I next welcome Dr. Premnath, our neurosurgery faculty. Sir, please give your inputs on how you are going to give your contents for the MS graduates. Dr. Premnath?
Yes, sir. Good evening, sir. Actually, I'm Dr. Premnath, neurosurgery resident from Madras Medical College, final year resident. So actually, I'm covering neurosurgery topics, especially basics topics for the general surgery residents. First of all, my sincere request for the residents is don't bunk the neurosurgery postings while specialty postings. Okay. This you should never bunk any of the specialty postings. Okay, at least you should show some interest in all the specialties. Before joining MS General Surgery, don't think I'm going to be a surgical gastro, I'm going to be a CVTS surgeon. So first to show interest in all the specialties, the basic specialties. After finishing all the specialties, you identify where you really interested. That's my sincere advice. On behalf of the neurosurgery, I am covering generally the Bailey and Seviston of neurosurgery topics, very basic topics only, of CSF flows and CSF infections and tumors, and some things about this basic anatomy of brain, and where the essays are usually asked, and especially the head injuries and trauma parts. So that is more than sufficient for surgical residents. And I am going to cover the clinical videos of basic examinations of CNS spot. So how to examine the power when a patient come to a trauma, especially in the cervical spine injury, and especially case of spinal injury cases and head trauma patients. And what are the initial investigations and management to be done? So everything I will cover. Yes, sir.
Dr. Prem, students are also asking what books to refer for super specialty. Any super specialty books, if you want to mention, you can mention, because most of them will be reading Sabiston. It's a basic for all MS graduates. MS graduates will be reading either Sabiston or Swartz only. Along with the Bailey, it's a basics. Any super specialty book specifically you want to mention, you can mention some topics which will be useful for them.
If you want to read some specialty book, means especially for the practical clinical cases, you can refer some gastroenterology books like
as a neurosurgeon, you tell about your book. I think all faculties will tell about their books.
It's a neurosurgery. I think so. Bailey and Sabiston is more than enough, sir.
More than
Bailey
enough.
and Sabiston is more than enough. They have given all the points. So especially Sabiston. It's a notes. It's a super good notes of a specialty, neurosurgery specialty. They can cover all. They are giving very simple points about all the things. I think for MCQ purpose also it is very useful for NEET assess.
Thank you, Dr. Prem.
Thank you, sir.
Thank you, Dr. Prem. Thank you so much for your inputs. Next, I request Dr. Isaki Rajan, our cardiothoracic vascular surgery faculty, to give inputs to the postgraduates who are preparing for their exams. Yes, sir. Please introduce about yourself, sir.
Good evening, everybody. I'm Dr. Isaki Rajan from Madurai. So I'm going to give you some insights on cardiovascular and thoracic surgery. And of course, everybody must have known that cardiovascular and thoracic surgery is a topic which has been thought to be a very difficult field. But for getting through the exam, we are supposed to know about the basics of cardiovascular and thoracic surgery. And of course, through the daily practice, daily practice, we are supposed to know about the basics of cardiovascular and thoracic surgery, like ICD insertion, chest examination, to deal with the emergency cases. Of course, cardiovascular thoracic surgery combines both the surgical aspect and also the medical aspects. So here I'm going to deal about chest trauma, preferably all chest trauma like rib fractures, sternal fractures, and chemothorax, pneumothorax, lung injuries, and also we're going to deal about cardiac injuries. And of course, mediastinum is also covered by me. Mediastinal injuries can occur, and of course, CA can occur in mediastinum. These are all the topics that is covered within the thorax. And compared to the other subtopics, CVTS will be quite easy for everybody because it is just a simple concepts. Rather than mugging up, you can just have the concept that is more than enough for cardiovascular and thoracic surgery. And of course, surgical procedures will also be taught by me, just to give you some interest on cardiovascular and thoracic surgery, because we are going to operate on the heart and aorta. So this will be, of course, interesting session. More than that, it will be a very informative session from cardiovascular thoracic surgery. And I'm sure that I'm going to inspire everybody to become a cardiovascular and thoracic surgeon. And in case of any doubts, at any time, people can approach me for cardiovascular thoracic surgery. This is the easiest subject that can be learned very well through this app. And I will make it very easy. Theory is, of course, separate thing. Practical is, of course, separate thing. Operative surgery is to create interest for you people to take cardiovascular and thoracic surgery. And this will be my aim here. And thank you. We will go further.
Thank you, Dr. Isaki. Thank you. So, Dr. Andani, ma'am, are you there?
Sir. Yes, sir.
Madam. Good evening, madam.
Yeah, good evening,
most of you would have seen ma'am's videos, excellent videos from Instagram. Madam is having so very good Insta channel. A lot of operative videos she has already put there. So I wanted to use those videos in a proper way in this program. So welcome, ma'am, for the operative procedures. I request you to do monthly one session, madam, on operative surgery. Definitely.
Yes.
Some
Sure,
surgery,
sir.
even small surgeries will be helpful for them. Even phimosis,
Yeah.
hydrocele, everything is useful for the students.
Yes,
Definitely,
sir.
many, as you know very well, ma'am, the exposure in many colleges has become very less because of
Mhm.
increased seats and number of patient input is low in many medical colleges.
Yes,
So it
sir.
will be very useful if you could give inputs on various operative procedures. So can you tell me, madam, what all operative procedures you are interested in showing to the students? Please
Sir,
introduce about yourself, ma'am.
yeah.
Please introduce about yourself.
Yeah, I'm Dr. Nandini. I'm a general surgeon. I'm an assistant professor of surgery in Omandurat Medical College, Chennai. So as Sir said, I've got a passion in teaching operative surgery already. So I've started an like Instagram handle where I'm posting like small videos, which is giving all the important hacks of so many surgeries, which is useful for the postgraduates. I also have an YouTube channel which has a full length videos, but there is no proper like curriculum for that. As Sir said, maybe we can go step by step, like the videos that are useful in the first year, second year, and to the third year students, like that we can split them up, I think, sir. And all the surgeries, like starting from suturing, we can teach them, sir. Starting from suturing to till the endoscopic suturing, we can teach to the students, sir, in a stepwise manner. And all the basic surgeries like open hernioplasty and thyroid and breast surgeries. Actually, I have like interested in teaching thyroid, breast, and all the gastrectomy also, sir. I have videos on that. So starting from basic surgeries like lipoma, sebaceous cyst to till thyroid, breast, gastrectomies, we can like teach them in a stepwise manner, sir.
That's great, madam. That's great, madam.
Yeah.
Because the most important thing is a stepwise approach for an MS
Yes,
graduate is
sir.
very important. Because
Yeah.
if you ask me or Dr. Sendil Kumar sir to teach, we might not be knowing to teach the basics because as we have become super specialty,
Mm.
we think
Yes, sir.
that the students will know that. But as you are with the postgraduates, you are
Yes,
working
sir.
with the
That is,
postgraduate,
yeah, sir.
many residents are training with you, so you will know
Sir.
what basics to be taught from the
Yeah.
right from the skin incision. You will be able to
Yes,
teach them.
right from
So that is very
anatomy.
important, ma'am.
Yes, right
Yes,
from
ma'am.
defining anatomy to demonstrating every step in a surgery, we can do in a very, I mean, like according to the methodology, sir. Mm.
Yes, ma'am. That's great, ma'am. Thank you so
And
much,
thanks
ma'am.
for
Thank you
giving
so
me this opportunity also, sir.
Thank you, ma'am. Welcome on board, madam. We are expecting
Yeah.
you so many videos from you. Thank you, ma'am.
Yeah. Thank you, sir. Thank you
Thank you
so
so
much.
much, ma'am. Thank you. And Dr. Mithun, Dr. Mithun is our
Good,
endocrine faculty.
good evening, sir.
Good evening, Dr. Mithun. Welcome. So, sir, endocrine surgery is being a scarce specialty. Many students might not have a good input about the specialty. So, how are you going to? Please introduce about yourself, sir, and please tell about what are the things we are going to do in the residency program from endocrine part.
I am Dr. Mithun Ram. I am an endocrine and breast surgeon. I am based in Lucknow at the moment. I am originally from Chennai. So, as sir said very rightly, endocrine surgery is a relatively new specialty. Not many people would have heard about it. But again, as for all from the MBBS level to MS level, thyroid and breast is the bread and butter of general surgery. It is something that everybody has to know in and out. If you have to pass the exam, there is no way to pass the exam without knowing thyroid and breast. So I think that is a very important part that I feel I should be able to contribute to the young MS general surgery postgraduates. And something interesting about endocrine surgery is that traditionally we think that surgery is a very anatomy based subject. Medicine is a very physiology based subject, but endocrine surgery is a unique specialty which combines both. So you cannot be a good endocrine surgeon without being a good endocrinologist or an endocrine physician. So you have to know your medicine, and it integrates medicine with surgery. And another important and interesting fact is it also integrates basic science very well. So I am intending to bring that angle into the general surgical training. So how do you utilize your knowledge of anatomy? How do you utilize the knowledge of physiology? And very importantly, how do you combine that with biochemistry? Along with pathology, even finer things like embryology makes a difference in the way you operate. And I think at this stage, this may be something that you will not realize, but as you mature and grow in your career, small things like knowing the embryological origin of structures and how they descend and how they finally come and sit in their normal positions, and how do you apply that to operative surgery is what will really be a game changer in your practice and your surgical knowledge, that will really make you mature as a surgeon. And I think that is what I intend to bring to this young general surgical postgraduates. Dr. Sendil mentioned about how the technology has changed a lot. We are taking training to a new, different level. There's a very exciting thing that has been started by DocTutorials under Dr. Rajamahendran's able leadership. So I'm really looking forward to having a exciting time with young postgraduates. Especially make sure that your thyroid and breast are spick and span, and you're ready to go for the exam very strongly.
Thank you, sir. Thank you, Dr. Mithun, so much. Thank you so much. Next, we have Dr. Arun, surgical gastroenterologist. Sir, Dr. Arun, are you available?
Yes, sir. Yes, sir.
Yeah, Dr. Arun is going to cover the surgical luminal part, like stomach, esophagus, one of the important topics, favorite topics of all your exams, especially theory question, essay questions, and all will come mostly from stomach, colorectum, everything. So Dr. Arun is going to cover all this GIT part. Already he has recorded around 20 hours of theory lectures in the app, is available now. And welcome, Dr. Arun. Please introduce about yourself and please guide about the course which is going to happen in the next 1 year.
Good evening, all the esteemed faculties present here, and distinguished guests, and most importantly, our postgraduate students, residents there. So here, thanks for the opportunity. First of all, now we at DocTutorials, we stand with great excitement that we introduce a groundbreaking addition to our academic offerings. It's a newly devised course tailored specifically to you people, to the postgraduate residents. This is just not another academic requirement. This is as far as our team is concerned, is a transformative journey for you people from the residency to your super specialty choosing, and to equip you with the skills, knowledge, and the mindset you need to pass the journey of your residency. So here we have under the leadership of Rajamandran sir, we have decided what all a resident needs that toward the end of his career, his or her career, and what he or she needs to pass the MS exams, as well as to go ahead in this world, in this competitive era, how to get rid of the postgraduate super specialty exams and the postgraduate exams. So all our curriculum is based on strong pillars, like we have got all the skills both clinically as well as the theoretical subjects, which we have covered from the very standard textbooks, especially the gastrointestinal part. We have chiseled down the Sabiston part right from the first chapter to the last chapter, and we have introduced even from good standard textbooks like Blumgart and Shackelford, some topics from that. And so that at the end of all this residency program, the thing I'm sure that you'll be able to understand all your topics which you have covered in residency with greater understanding and even in core depth, so that it will not only help you to pass the residency program, it will kindle the interest in you in gastroenterology. Mostly you people all will be interested in gastroenterology, as many people are. And a step ahead, it will take you to ponder into your residency or super specialty program as well. So so I look forward so that you go through all the topics here which we have covered, and give us the feedback, and we can improve then and there. Thank you, Rajamandran sir and DocTutorials team for this opportunity.
Thank you, Dr. Arun. Thank you so much. So there are a few questions from the YouTube live. Dr. Varshini has asked how to manage study and what works, inputs on how to plan a study routine, sir. So she's asking about how to plan routine, because you know very well residency program will be hectic in many places. It will be very difficult to manage the ward work. I think Dr. Gopal will be the ideal person because he's an assistant professor. He might be seeing the postgraduates. Can you tell me, Gopal, how to manage this work stress and prepare simultaneously?
Yes, sir. Sir, during the first year, we just have to ward work only. In the residency, the first years of the resident will go in the ward and into the side rooms of the ward. So basically, in first year, we just have to observe what we are going to, or the our seniors are doing the procedures or doing the clinical works in the OPD or in the casualty. So in the first year, we have to just observe. Don't take a very much pressure about the study in the first year itself. We will learn at the end of the first year to study and to manage the ward works or the clinical works and the operative procedure. So initially, we don't have to take so much stress regarding the study in the first year itself. We will make the we will have the very much time after the at the end of the first year and the second year and third year. It will be manageable at the end of the second year and third year. We will just have to observe the patients. The patients are the most important thing during the first years. So basically, during the first year, we have to just observe our ship, and after the second year, we have to go for the studies and for the our academic things. So we will manage the things at the end of the first year. So it will be manageable after the second year and third year, and we have to check the app regularly, so that before going to for any procedures, or if you are going to for any presentation, just have a look of search your topics before presentation or before procedures, and see the video or see the operative procedure before anything. It will be combine your theory as well as practical aspects.
Thank you. Thank you,
Thanks.
Dr. Gopal. Thank you so much. There is a question from Dr. Ravi Teja. So discuss about the 3 years residency. Discuss about 3 years of residency program, what we are going to conduct, and about the 3 years of residency, as most of the things are told by Dr. Gopal here, and how to manage caseload, because the caseload will be very high in some institute. The students will have no time to open the books. So at that time, definitely our app is going to be a very important boost for them. So whenever they get a time, they can open the app and they can listen with the headphone. They can listen whatever case they are going to see at that time. They can open that topic will be in our app according to Sabist and all the topics we are covering. So you can utilize that videos during the preparation. And who is just starting? Another question for you, Dr. Arun. This question will be suitable for you. There is a question: when should I start SS preparation? I am a resident who has joined first year now. When should I start super specialty preparation? Is a question from one student. Can you tell me, Dr. Arun, anything about that?
Yeah.
When did you start your preparation for getting MCH?
So those days, I think it's a different kind of scenario when we were the residents there. Now it's a different scenario altogether. But to answer this question, I strictly believe what Gopal sir said. So your ward is your teacher. So those patients who are there at present with you, they are your study material. So whatever patient you are dealing with, for example, a case of carcinoma stomach, for example, a case of obstructive jaundice, you need to just open our app and go to the corresponding topic, and then go through it thoroughly, and just compare the standard teachings and how you deal with the patient. It is through this you learn and how to go about a case, and then the things you imbibe by this way of learning is the one which will stay with you for longer period of time. And if you cover all those topics according to the patients you deal with, you will almost cover entire core except the miscellaneous topics which will be left with. And as far as the super specialty is concerned, so you need to have a broader idea of the subject which you are dealing with, as well as the questions which are asked at the super specialty level. So as far as the super specialty level is concerned, it is all about Sabiston and Bailey these days. It was different when we were preparing. It was purely from those two textbooks like Shackelford and Blumgard. Now that with Sabiston and Bailey covering the majority of the topic questions, and that you have all those topics covered in your app, I think it's going to be easy to deal with the super specialty level questions once you have started preparing the app wise topics. And once if you finish the residency program, then you will be at a position where you can deal with the super specialty GAT as well as the residency exams. There is no separate preparation as far as I hope my colleagues will agree with it. As far as GAT and HPB is concerned, we have almost broken the semester into subtopics, and I hope I have answered the questions there.
Thank you, Dr. Arun. Thank you so much. And Dr. Senthil, anything you want to tell specifically for the students? Yes.
See, the question on when you should start preparing is a very individual question. It is not like a generalized answer that will suit everybody. What is right for you may not be the right. A person, a PG doing general surgery in a very busy institute, say like AIMS, will not even have time to go through what is the basic stuff that he needs to do that day. Whereas a national board candidate sitting in a place where there is hardly anything to do can plan it step by step. So it has to be individualized. But what I would like to say is we not just residency program will not only guide you for the NEET preparation and what to select, but it will also give you an idea of like what the cardiothoracic surgeon was telling. It will also incite you into look into surgeries that you probably don't see at all. A surgeon may get really interested in cardiac surgery, seeing a beating heart CABG. Nothing like that to motivate a surgeon to take up CABG and CTAs as a specialty. Likewise, how I got motivated in oncosurgeries when I saw professors like Rajaram sir, when they were operating on a head and neck cancer, I got motivated. That was the way I got motivated in doing an oncosurgery. The other aspect I would like to talk about is we should also aim at having the syllabus and exam pattern in certain institutes. Certain universities are different. For example, in certain places, we have something like a pedagogy. Pedagogy is they just tell you a topic and nothing, no questions are asked. The candidate has to talk about the procedure or talk about that thing. For example, they might tell you something like obstructive jaundice. They might just tell you an obstructive jaundice. They will not ask any question. The candidate has to speak on the topic. So unless these are all prepared and unless the candidate is exposed to these sort of things, it never happens. And we should also look at training them for certain exposure to certain exams, foreign exams like Royal College. Like if somebody wants to take up MRCS, many of us are already people who have cleared Royal College surgeons. So we can also tell them that at the end of first year or second year, whenever they want to do, we can also have some small sessions on how to take these exams, how to prepare for it. And these sort of motivational things will also help them as to what books they have to read, how to prepare, and guide them regarding these exams as well. Thank you.
So there's another question from a student, Dr. Varshini. Thank you so much, Senthil. Thank you so much. So there are some voice issues. Dr. Varshini is asking one question. How long this course will be? Madam, this is not a course planned for 1 year or 2 years. This is like already we have uploaded all the theory part of Sabiston already is uploaded. You can open and you can see it's 5 days. They are giving a 1 week free for the students to have an idea about that. So we are already giving the theory part is completely over. Whatever essay question, short notes being asked in various universities like Rajiv Gandhi University, MGR University, and whichever university we could get, we have collected and put all the essay questions and short notes we already posted. And now we are focusing on the clinical questions. So we felt clinical questions also we can record in 2-3 days. We can go back and we can record and finish off all the clinical cases. But we felt the clinical case discussion should be double way. So we should be discussing, and that time we expect you to ask some queries, doubts, and we expect to ask some questions on your side. So it should be like an MBBS. You should go back like a final year MBBS student with respect to clinical case discussion. That is why we have made the clinical discussion as completely a live video. And also we thought of recording the operative procedures. Here again, we had the same doubt, whether if we are going to just record and put the operative surgeries, where will you go and ask the doubt? So therefore, when we are going to do an operative procedure, for example, when we are doing a modified radical mastectomy, operative procedure is going on. At that time, we will be telling this is a medial boundary of axial dissection, that is a Bell's. Now, at that time, you can have a doubt, sir, how to identify this now? Is there any landmark to identify the now? Like that, you can ask the question to the faculty who is doing the live video. So it will be definitely useful for you. So mostly this is a live session which will be going on continuously. This is a never-ending program. This program will be done every month. We have planned for 5 live sessions, each 2 hours. So 10 hours we have live program every month. This is going to be no limited period. We will be going according to the students who are in the WhatsApp group, who have subscribed the app. They will be asking, sir, please do thyroid this week. This month means we will plan for thyroid. Please do inguinal hernia this month. We will do inguinal hernia. Like that, we will be going according to your request. But what is basically needed for a theory or theory exam is already there in that. So every question, every short note essay has been already uploaded, nearly 100 hours. We have recorded and we have put in the app already. So you can go through that for your theory part, practical part, and operative surgery part. We want to be with you. And we are forming a closed WhatsApp group where you can ask any doubts. All the faculties, you can, there are 14 faculties now. You can tag corresponding faculty and you can ask the doubt. See, there are so many other institutes and apps starting. Once we started residency program, we are seeing a lot of people are starting residency program. See, none of the residency program we have seen are having the variety of specialists as we have. So many residency program are done by only 1 or 2 faculties. You can see here we have already formed a 14 members team, and we are going to add up 3 or more faculties for operative surgeries, and for some other special topics we are going to add. So this is a extraordinary program from DocTutorials. So please utilize this. And Dr. Akhilesh has posted, so please upload the videos. We have already uploaded all the theory videos. Please go through the theory videos. Practical videos will be uploaded as early as possible. Once we complete the session, immediately it will be uploaded in the app. So thank you so much for all your time. Dr. Isaki, Dr. Arun, Dr. Gopal, Dr. Sendil, Dr. Mithun, thank you for your session. We'll be staying active and we'll be doing more sessions soon. Thank you so much, sir. So thank you, Dr. Drills, for providing the opportunity for this session. Thank you so much. Bye.
Bye.
Bye. Thank you, sir.
Thank you. You can stop the live. Yes.